I'm Sammy. I'm going to be your nurse for today. I understand you're not feeling too well. Okay, I'm going to take your personal details and then I'll come back, find out what seems to be the problem. We'll do some checks and get you feeling better. Okay. Can I take your name, please? How are you spelling that? And can you confirm your date of birth for me? Thank you. And can you confirm your home address? And the postcode? Thank you. What seems to be the problem? Intense migraines. Okay. You feel super dizzy? Oh, you're very tired. Okay, so just no energy whatsoever. How long have you had these headaches? 2 weeks? Are you currently taking any medication to help with the headaches? No. Okay. And the dizziness, is this coming in waves or is it constant? Waves. Okay. Is there a point throughout the day when you do feel energised, or is it constant tiredness? Pretty much constant. Okay. Would you describe the headache as a pushing sensation? Almost unbearable. Okay. Right, you poor thing. Let's have a look and try and figure out what's going on with you. So we're saying that you felt like this for around 2 weeks. Now's the perfect time to get yourself checked, so thanks for making that step. Are you on any new medication? Have you started any new medication in the last 3 months? Since 2020 began? Any antibiotics? Contraceptives? No? Okay. No new medication in the blood? I just wanted to check because sometimes our bodies and our reactions, they alter, depend on what we put inside ourselves. Right, so I'm going to do some checks now, try and establish why you're feeling this way. Hopefully we'll get to the bottom of it and we can start to get you feeling better. Okay, so the first thing I want to check under the circumstances lately is the temperature of your body. When our body creates a fever, it's because we have a foreign object in there, whether it be a virus, whether it be something in the blood, and it spikes because it means our immune system's trying to fight it. So the first sign of me knowing that there's something in there that's giving you hassle and giving you all these symptoms is by checking your temperature. So the best way for me to check is in the ear as an adult. So I'm just going to pop this in your ear. Yeah, as babies they do. I put them under their armpits. Yeah, I think as adults everything just gets a bit more, it changes a lot today. Nearly done. Okay, so we're 36.4, that's an excellent sign. So you don't have a temperature. 36.4 is a really healthy score. Yeah. So your body doesn't seem to be fighting any viruses or infections, so that's a brilliant sign. Yeah, under the circumstances, that's a great relief. So the next thing that I want to do, because your migraine's really concerning me, is I want to check your vision and your eyes. A lot of the time with migraines, it can be that it's an underlying vision issue. You can need glasses, or the actual muscles that control the eyes are not working as they should, and it causes pressure and tension in the head. So this is going to be quite bright. It's going to be a light that I need you to follow. Whilst you're following the light, I'm going to be looking at how your eyes move and how your muscles are going left to right. I'm going to just have a check behind your eyes, make sure there's nothing that should be behind there. That's not usually. So if this is a bit bright, I do apologise. So I just need you to focus on the light and follow it for me. Just keep following that for me. just going to hold your eyelid. I want you to look down. This eye, look down. Look at my nose. Look at my nose. I want you to look at my finger now. As it's coming closer. Perfect. And follow this finger for me. Just kind of keep your focus as long as you can. Put your eyelid. Right. Perfect. Everything seems absolutely fine in your eyes. Your muscles are working perfectly, so they are following the light exactly how they should be doing. There's nothing untoward hanging behind your eyes that's kind of creating any tension for the headache. So that's brilliant news. So the next thing I want to check with you is your throat, because sometimes throat issues or glandular problems again can lead to headaches and especially dizziness. Can you just say ah for me? Put your tongue down. Do you drink a lot of water? Not as much as you should, okay. At least you're honest. It's a bit red. I wouldn't say swelling, but it's a bit dry. Yeah. Right, okay. We may have to just look at the throat again. So there is a bit of redness there. Just going to make a note of that. So with dizziness, it's also very much linked to the ears. So I'm going to take a look inside both of your ears and make sure they're nice and healthy, because if your ears are off, it can be vertigo and other issues. Even things like hair conditioner, shampoo can block your ears and lead to extreme dizziness and headaches. Yeah. So I'm just going to check your ear. You just turn your head slightly for me. Okay. That one looks clear. And you just turn your head slightly this way. That looks clear as well. So you've got great ears, well done. There's nothing in the ears that's untoward. Clear ears, clear eye control, perfect temperature. I don't think you are actually poorly. I know. We'll figure it out. Okay, so what I want to do now is check your blood pressure. Low blood pressure can contribute a lot towards dizziness and headaches. It's not a matter of urgency as such. The issues come when the blood pressure's high, but if it's very low, it can indicate why you're dizzy and why you have issues standing up quickly. Okay, yeah, high blood pressure can lead to intense headaches as well because of the pressure that your heart's under. So by ruling this out, we're going to see which level we're at and whether that's contributing to how you feel. Okay, so I'm just using an electronic one today. So if you can just put your left arm out. Yeah, if you can roll your sleeve up. And just place your arm out in front of me. Thank you. Yeah, the old ones had the pumps, right? I remember those when I was having my baby before. They're kind of cool, aren't they? Oh, they brought all the new ones in now. I think these are a bit more accurate. Okay, just try and relax. You can hold my hand if it makes you feel better. It'll feel very tight and then it'll release. If it's uncomfortable, just breathe through your nose and breathe out again. I know a lot of people don't like this. And it's released. we've got 131 over 94. 131 over 94. Now, what that score actually means is your blood pressure is pre-high, so it's not high, it's not red, it's not in the danger level for heart disease and stroke, but it's also not green. So basically this can be a touch of dehydration, this can be a touch of anxiety. It's nothing major to worry about. It's not as healthy as it could be for your age, however it's not a massive issue, and we have to take into account that you're feeling anxious about your symptoms and that you're in an environment that you're not used to. Does that happen to you a lot? Yeah, people find that if they have one of these at home they get different readings because they're comfortable. Yeah, it's nothing to worry about. I'd say that that's not a matter for concern. I'd deem that as healthy because of the environment that we're in, so don't worry. Right, so I'm just gonna put some hand sanitizer on because I'm gonna be feeling your pulse. I want to check your heart rate. Make sure that your heart's beating in time, it's not skipping any beats, and it's nice and healthy. So if you can just place your hand out. Thank you. Fantastic. You've got a really strong heart. Very strong heartbeat. That's a really healthy rhythm. There's nothing to worry about at all. Okay, so your blood pressure, we're not worried about that. Your heartbeat's fantastic. I don't think it's anything relating to your heart. I don't think it's anything relating to your eyes, ears, or your throat. There's a little bit of redness in your throat, but I think we can work on that. So, before you entered the room today, I asked you whether you could give a urine sample to reception. Did you do that for me? Oh, you did? Fine. Can I take it, please? Thank you. Okay. So what I'm noticing immediately from this sample is you are very, very dehydrated. This is a big concern. As you can tell, the urine is very, very dark. Now, in a healthy, hydrated person, you should be able to see through the urine. It should be very clear or like straw coloured. Yeah, this definitely indicates immediately that you're not drinking enough water. Dehydration contributes to headaches, dizziness. You just don't like water. Okay, I understand. I'll give you some alternatives once I've tested this urine for you. So I'm just going to put in my pH strips and see whether there's anything underlying in your urine. It's a great indication to find out if there's anything a bit untoward and if the pH levels are on balance. Okay. That's absolutely fine. Your urine is healthy in the sense of the pH balance. I'll just dispose of that now. It's not healthy in terms of hydration. It's very, very dark. If you don't like water, I would 100% suggest putting a bit of cordial in there. Maybe get drinks like Oasis, or eat ice lollies and ice pops, and anything where it's a large amount of water in the drink with just a little bit added to it. Maybe you could cut up some fruit yourself and add that into the water. You really need to drink more though. Yeah, that urine's really shown me that your symptoms could all be led to lots of dehydration. Okay, I'm just going to touch your temples now. I need to find out why the pressure is hiding under your head. So you just relax. Does that hurt? Yeah? I'm going to move around the back. Push on the back of your scalp. Does that hurt? Not so much. Okay. Does that hurt? When I bring around the front, that hurts more. When I'm pushing on the temples, that hurts more. Yeah. Okay, so all the pressure is at the front. So what I've seen from the checkup is you are severely dehydrated. Now, I know people don't want to be told to drink water, and it's kind of the traditional 85 a day drink your water, and I know people sometimes don't pay attention to it, but water is a massive factor in keeping you healthy. I really want you to increase your water intake, because I really feel like the headache, the dizziness, and the lack of energy, the best form of energy is in water, believe it or not. You can buy sugary drinks and you can buy energy drinks, but the water will suffice for your energy. You'll really feel your energy go up, even if you add lemon water. I really want you to focus on your hydration. I really feel like you have some anxiety underlying. From what we discussed in our last appointment, I know you're still suffering with your anxiety. At a time like this, it's absolutely understandable to be suffering with larger bouts of worry. Are you sleeping? You're anxious at night. Yeah. See, this is all contributing to the headache and the dizziness because you're not getting any fresh air. And I know that's quite difficult as humans. We need the fresh air, we need the vitamin D. And if you're in one room a lot, it's going to contribute to head, dizziness, tiredness, just feeling quite groggy and lethargic. Hopefully it'll pass soon. Yeah. I'm sorry I don't have any information about when this will pass. The only thing that I can suggest is go for a walk every single day. Breathe some fresh air through your window when possible. Keep yourself hydrated. It's very important that you do that. Are you wanting any medication prescribing today for your anxiety levels? I know normally you've said no. Yeah, you don't want that in your system. That's a personal choice. A lot of people don't want anxiety medication, but a lot of people are reliant upon it. It really does help some people, but that's absolutely your decision and you don't want it. Okay, so I've got a herbal relief spray here, which is for anxiety. So instead of placing neurological medication in your system, this one, you open your mouth, place your tongue out, and it's a quick 2 sprays, and it calms you down instantly through the power of herbal flowers. If you can just pop your tongue out for me, I'll just pop your tongue out. Yeah, the redness at the back's dehydration. You need some more water. Okay, so what I'm going to do is I'm going to put this anxiety relief spray on your tongue. That's going to trickle down the throat and you should instantly feel calmer. On the way back, if you can get a bottle of water, that'd be fantastic. If you can't, as soon as you get home, please keep up to your hydration. Okay, open. Yeah, tastes a bit like lavender, right? Yeah, but you should instantly feel like this natural, overwhelming calmness now in your body. They're fantastic. They are herbal, they're all natural, there's nothing addictive in there. Also some recommendations that I tell to my patients is get an adult's colouring book, pass the time by colouring in numbers, get loads of baths, do some face masks, really concentrate on looking after yourself personally, read your favourite book. Positive affirmations are great. We have some great apps on the website where you can download the app and it keeps you calm, regains your focus. Another thing that I'd recommend is if you're on social media, just limit that a bit. Social media can be fantastic at the best of times to connect with old friends and to see what everybody's up to, but I think in the current climate sometimes social media can create a bit more anxiety. Try and focus on yourself and your family. Yeah, if you see these negative headlines, sometimes they're not all true and it triggers and then it makes you feel physically poorly because your body goes in fight or flight. I really feel like that's what's happening to you today. You've been in isolation a long time, you've got a headache, you've got dizziness, you feel really groggy, tired. The hydration will help you a lot, as will remaining calm, using the herbal spray because you don't want physical medication. If you change your mind at any point and it gets too much and you would like to go on actual medication, you can always give me a call. We'll look into a prescription for you, put you on a low dose, and then we'll build our way up, depending. Yeah. Okay, so I'm not going to give you a prescription today because I genuinely feel like it's just a case of TLC. Your heart is absolutely perfect, your vision's perfect, your muscles are perfect, your ears look great, your throat's not bad, your blood pressure, everything about the checks and the urine are spot on physically. I can't find anything that would be alarming for me, so I do all think it's mental because it's a hard time to get through mentally, and a hydration issue. Okay. Well, it's been fantastic to see you. Promise me that you're going to drink your water. Okay. I will give you a call. Let me write this down. So I've got my notes here. So I'm going to give you a follow-up call next week. Yeah, that'd be nice if we weren't. I've got a feeling we will still be in isolation. I'll give you a follow-up call. And I want you to try and drink 4 to 5 glasses of water a day. Put lemon in or fruit, like the advice I've given you. And I want you to tell me whether you feel a difference. Okay. I've got a phone number here for you. Can you just confirm that that's still correct? Perfect. You know your mobile number off by heart. I still don't know mine. I've had mine 7 years. I don't know off by heart yet. I have to get my phone out. I will give you a follow-up call. I'm sorry that you're not feeling at your best. I think a lot of people are feeling this way. Hopefully it will pass, and the next time I see you, hopefully we'll be all smiles and things will start